really the one thing I always wanted to do in my life, and because of Ms. Carabin, I realized that I can do healthcare and educate at the same time, and that's through dental hygiene. That's what I do. So I've been a dental hygienist for 3 years now, and it's been crazy, it's been relaxed, it's been all the joys of healthcare that one can possibly get. But I was there in your shoes, not knowing what I wanted to do, and you know, you're filling out college applications, you're just, maybe I want to be an engineer, maybe I want to be a lawyer, maybe I want to be a speech pathologist, but oh, I don't really like school that much. You know, those programs take a while. Those are 5, 6 years of school. My program was 2 years. I did it in 3 because I got my bachelor's degree, but with dental hygiene, you can have an associate's. The associate's degree was great. You can be in a clinical setting your whole life if that's what you want. I got the bachelor's degree because I wanted to be able to expand what I wanted to do with dental hygiene. Let's say if in a couple years my back starts to hurt, because it's a very taxing job. Your hands, your feet, your back, your neck. I really put my all into my patients and their cleanings, and a lot of people complain. Some people like it, but that's up to them. I can go back into school. I can become a teacher. I can become a representative for companies that you brush your teeth with. Colgate, Crest, Arm & Hammer, Sensodyne. I can go around to dental offices and just talk and educate. And I think education is what people don't see as an aspect in healthcare. They just see it as, okay, I'm gonna treat this patient, but it's how you treat that patient. I'm not just cleaning teeth. That's the most misconception of dental hygiene, is that I just clean teeth. I don't just clean your teeth. I take your medical history, I look at blood pressure, I look at medications, I look at what's wrong with the body systemically. I talk about diet, I look at, I'm looking for oral cancers, I'm co-diagnosing for the dentist before the dentist even comes in. I'm like, hey, this tooth doesn't look right, or hey, this patient had a hip replacement 2 months ago and now they're here and their orthopedist said it was fine, but I don't think it's fine that they're here. So there's things that you need to be aware of that relate to all of your programs that you've already taken. Biochemistry is, of course, I took anatomy and physiology 1 and 2, which basically they just split anatomy into 2 semesters like you guys do. And then there's nutrition counseling, tobacco cessation, you know, how everything affects the body. It's more than just the mouth. So you have to look at, you know, why is a patient bleeding so much? It's okay, it's easy to just tell them, go floss. How many of you have heard that? You're not flossing enough? Yes, it's easy just to say that. Okay, you have a patient that brushes 2 times a day and flosses 2 times a day, I'm still bleeding, I don't know why. Okay, now we have to break it down. What are you doing? How often are you eating? What are you eating? Are you drinking sodas all day? Are you a candy lover? Do you smoke vapes, cigarettes? Are you on birth control? I found that was the biggest thing for me. I brushed my teeth twice a day, I flossed twice a day, I was still bleeding. Why? My birth control. So anything that you put in your body affects you from head to toe. It's not just about your mouth. Why you're bleeding is not just because you don't brush or don't floss. There's things that go into it. So my biggest thing was education. You know, I like to sit and I take a big chunk of my appointment times and I talk to patients about what they're doing. I break it down with, okay, maybe you're brushing the wrong way. How many of you scrub? You wake up and you scrub your teeth really hard and aggressively? Yeah, okay. I take the time with some people and I show them, I'm like, no, that's not it. It's really light, gentle circles, really nice, and it should be 2 minutes. The correlation is the entire happy birthday song or your ABCs twice. That's how long you should be brushing your teeth. When people tell me it's 30 seconds, I'm like, well, that's not really efficient. And then you pull up all your charts. I love diagrams. I'm a big diagram person. I was always a visual learner. Miss Kay pointed that out today. She's all about the visuals, and I was all about the visuals. I like charts, I like diagrams, I like flashy things, because it's the big picture. My newest thing now is with Listerine. I love recommending the Listerine, the gum therapy. What's the bottle? It's the one with the pink label, super easy to find. So that's, or the purple one, if you have a lot of cavities. So there's things that I need to know, and I'm always educating myself. I read journals, I read different publications, I'm taking CE courses, so my education never stops. So if my education were to stop, I wouldn't be able to educate you. Everything's changing. I'm walking around the buildings, things are very different from when I was here 10 years ago. That's So it's all little things. Some things don't change, some things with dental hygiene has been consistent, but there's always things updating and changing. So that's what I do. I love to teach. I love to take care of patients. And if I didn't, I would be in the wrong field. So, you guys have anything you want to talk about?